The broadcast is now starting. All attendees are in listen-only mode.
Hi everybody, welcome to today's Lunch and Learn webinar. My name is Donald O'Neill and I'm the Marketing Manager for Clonwilliam Health, and with me I have Glenda O'Neill, who's going to be running through some training on PCRS Parsing. So the format of today is pretty much the same as all of our other webinars. Glenda will run through the training, and then if you have any questions along the way, please do use the questions tab in the control panel, which will be on the right hand side of your screen. Basically, you should see a tab saying questions there. If you click on that and then type the questions in there, it'll come through to us, and I'll ask Glenda the questions at the end of the webinar. So if you do have any questions, please just shout and we'll do our best to get through them all before we finish up. So without further ado, I'm going to pass the controls over to Glenda, and she's going to take you through the subject matter of today's training. So Glenda, this should be winging its way to you now.
Great, thanks. Okay.
Perfect, yeah.
Parser. Now, obviously, I'm on a test system here, and when I'm downloading the file and stuff, I have just created a quick PowerPoint when you use the PCRS website, because obviously I don't have it from here. Good. Down to down here, and the one we're going to focus on today will be PCRS Parser. So when I click on that, I get this screen over here. It gives me the option to log into the PCRS website. So what I'm doing here is I'm going into the PCRS website and I'm going to download my file from their website. And when I click this link, or when you click this link, it will take you in to the PCRS website. And because obviously I don't have a connection, you can see what happens there. But basically what it will look like for you is when I click in, when you open it up, this is where you will land. You'll land in the doctor application suite. And you can see I'm acting as doctor. So whatever your doctor number is will show here. And what you will do is you will click on panel management, and then you will click capitation drill down. And then if you scroll down to the next slide, you'll go into capitation download. So that's kind of the path in. Now, if you don't remember that, or if you don't get a chance to take that down, if you press F1 on your Health One application, you'll see like a training guide in there for the PCRS parser. And in that guide I go through, I give this kind of path. So don't worry if you don't get it taken down today, you can actually follow the document from there. So the next one down, the next screen, once you click capitation download, the next screen you will see will be full patient list. And that's the one we want to download. So we want to download our full patient list here, and we click the download button. And when we click that, it's going to pop up as if you were downloading anything. It pops up and it asks you where you want to save that file. So you'll save that file. I save mine to my C drive and into my HomeWin and PCRS parser, but you'll probably save it to downloads or whatever works for you. But if I go back to Health One now, so I've downloaded my file, so I have my file from the PCRS, and I go back into Health One, and I'm going to open the file here, so open from directory. So the first step is download it from the PCRS website, and now we're going to pick the file up and bring it into Health One. And to do that, we click open from directory. And I have my file here, and you can see it's saved. I've saved it in my C drive and in my HomeWin, and I have a folder in there called PCRS Parser. And this is my file here. So I'm going to click this file, and I'll say open. And straight away, the file has loaded into Health One. And you can see it's my acting as doctor number here. Obviously, I'm on a test system here as well. So usually your name will be in here. And the file name and the total patients, it's counting in here that there's 270 patients on this list. So I haven't done anything yet. I haven't began the kind of comparison. It's just telling me at this point that the list has 270 patients in it. So underneath here, we have a couple of options. And this option lists for all doctors in the practice have been selected. So if, in my case here, I'm the only doctor in my practice, so I'm going to tick that on because I want this list to compare against Health One, because Health One is I'm the only person, the only doctor in the database. But if you're in a practice that has a number of different doctors in here and you're comparing one list, you may want to leave that box unticked, because what will happen is your results down here there'll be discrepancies in your results, because it will be looking into Health One and the other doctor's patients will be showing on your list not found in the PCRS file. So you only want to tick that on if it's just your doctor in the practice, if there's just one doctor. The only other way you could tick that on would be if you're in a practice with a number of doctors and all the doctors are all listed under one GMS number. So if they're all listed under one GMS number, then they're all under one file. So I could tick this box on. So I'll tick it on for myself here now. The next option down, because I'm not in a kind of a real file, these options are grayed out, but normally they will be active. The second one is auto update the IHI number. So this IHI number, the individual health identifier number that's coming in, when it's included in the PCRS file, if we tick that on there, what it will do is it will update Health One, all the patients in Health One with their IHI number. And then the last option here is update the doctor in charge. And again, because I'm not in a kind of a live system with a live doctor, I'm not seeing this option, but you will see that option, be able to tick that on. And it says here the doctor name can't be initialized on the unselected files. That's because of this here. But what you'll do is update the doctor in charge. So what that will do is if I was to tick that on, it will look at the PCRS file, it will look at Health One, and if there's a difference in the two, it will update the doctor in charge. So the doctor in charge item in Health One will be updated with the doctor. That's up here. So there are the couple of options there on the side. So I'm going to leave the first one ticked on, and I'll go down here to my start button down at the bottom. So once I press start, it's going to analyze. Basically, it's taken the PCRS file and it's checking against my Health One database, and it's going to do a comparison to the results I have in my database against what the PCRS have. So we click on start. And because obviously this pop-up won't pop up for you, it's just because, again, like I said, I'm not in a live file. So it has analyzed my data here, and you can see there, it did it quite quickly. It analyzed 270 in 1 second. So it is quite a fast kind of analysis. So it's given me kind of a breakdown of my results here. So it's saying it matched on 254 patients. So out of the total 270 records that were in the PCRS file, it was able to match on 254 records. And this is the kind of listings over here that I'm going to go through, and I'm going to explain all of these in detail in a second. Number of IHI numbers updated, 0, because I didn't have that ticked on, so I didn't update any. Patients matching on identifiers. So it's 7 patients in here that have matched on, the identifiers in Health One are surname, first name, sex, and date of birth. So it has matched on them, but it has said there's 7 records in Health One that have matched on the identifiers, but the GMS number or the expiry date is different to what I have in Health One. So the GMS or expiry on the PCRS listing is different to what I have put in Health One. Patients not found, 9. So patients not found locally. So it means that there's 9 patients in this PCRS file that are not on my Health One system. And I'm going to go through that list over here again in a second. And then local GMS patients not in the list. So that means there's 3 patients in my Health One system that are not on the PCRS listing, and you can see that there. So we'll go over here to the left-hand side, and we'll run through each of the menus along the side here and just go through the options. So the first option here, matching patients. So like I was saying, this list is has just done a comparison against what's in Health One, against what the PCRS have, and it has matched 254. And there's not really anything that needs to be done with this list. This list is as it is. It's just a matched list. You can down here, you can open the file and you can update the IHI number and things like that. You can also, on the second tab across here, you have a cube analysis. And if you click on that, you can see there it breaks it down by your GMS by age, and you can see your different nursing home patients and stuff. So you have a nice little analysis in there just for your own records. And you can also export your list to Excel with the Excel sheet there if you needed to. But to be honest, there's nothing really that needs to be done with this list. This list is just telling you that out of your 270 patients, you've got a match of 254. So the next list down is one that we'll focus on. So matching on identifiers. So like I was saying earlier, identifiers in Health One are surname, first name, sex, and date of birth. So if Health One, when you download the PCRS list, if it sees all that information is matching, but it sees a difference in the GMS number or the expiry date, they will show on this list. So what that means is your Health One maybe has a different expiry date or a different GMS number. And because the PCRS listing is the list that you get paid from, we'll always assume that the PCRS listing is correct. So we want to update our Health One system with the information that the PCRS has, because as I say, that's the list you're being paid from. So you could go in and you could select each one individually, and you can see I highlight it with a blue line, and I can press update. And it's just giving me the option here. It's saying I update the category, the GMS number, and the PPS number, and I'll just say OK. And it has updated that record for me. But if I have a lot on this list, I don't want to have to do them all one at a time, because as I say, we're going to assume that this list is correct. So we want this information to be added to our Health One system so that we don't have a different expiry date against the patient to what the PCRS has. So in that case, I'll click the little box in the corner here. You can see that little kind of gray box up in the corner. And what that will do is, it's like Excel, it's like it selects everything. So it selects my whole list here, and I will press update. And what that will do is that will go into Health One, and as I say, it will update the GMS details with the GMS number and the expiry date. So my system will be the same as what the PCRS have. So that's really important, because if somebody's coming in and you think their expiry date is not for another 2 months, but actually is expiring next week, at least you know that by running this list. So the next option down, patient not found locally. So you can see here, this screen kind of breaks into two halves. And what this is saying is, it's not finding these patients in Health One. And that can be for a number of reasons. It could be that the patient is on the PCRS listing, but it's not in your Health One database. Or more likely it is that there's something in the spelling maybe, or you might have it spelled one way and the PCRS have it spelled a different way. And Health One will only match it if it gets an exact match, the same as what the PCRS has to what's in your Health One system. So you can see down at the bottom here, this is the top list. The top half of the screen is my list according to the PCRS. And then the bottom half of the list is Health One trying to kind of help you match the patient. So down here at the bottom, you can see anything in green. So it has matched on first name and surname in here. And obviously I had to anonymize the data just because, not that I'm using live data anyway, but I just have it anonymized just to be sure. So you can see there, if I did have that data opened, I would see the name will be identical here, the surname, the first name will be identical here, but there's something different within the birth date in here. So the two dates of birth are different. So you might look at this and it might be like, in the original file, it might be say 14/10/2015, and you know that patient, that is the correct match for that patient. And if it is, you'll just press update. And what that will do, that will just update your system to say that this record is the same as this record here. So when I press update, do I want to update this patient? And I'll just say yes. And that patient is now updated there. So you could go through this listing, patients not found locally. The first time you run this, you may get a lot of records in it, but each one will have to be kind of gone through individually, because you need to be checking just to see, you need to check each one just to match them to the patients in Health One. So again, you can see down here, this one matched on surname, but it didn't match the first name and it didn't match the birth date. So again, I would look up here, I would know myself if this is the correct record. If it's not the correct record, I will do a manual update. And when I click manual update, I'll go in and I'll search my database. So this is in my live database here, and I can go in and search for a record that I know that record belongs to. I can also, if it's a record that's not in my system, I can create HCR. So that will create a file with this information in my Health One database. So you can see, you'll click through, and in some cases, like Health One didn't find any match. So it didn't find anything in here with a first name, a surname, a sex, or a date of birth that matched down here. So there's nothing in there. So in that case, I would probably do a manual update and find the record. So you'll scroll through this list and you'll go through each one and you'll update them, or you'll do your manual update there. And eventually that will go down to 0. And then the next time you download the file, all those records will all be matched. So that list will reduce as time goes on, unless there has been a change. So that's your patients not found locally. The patients not in the PCRS file. So in my case, I have 3 patients on my Health One database that are not on the PCRS listing. So what that means is there's 3 patients in my Health One system with a valid GMS number. So they have a valid GMS number, but they're not part of my PCRS. So they belong to a different doctor. So I can just press the update there if I want to update them, but it's just, and that's the patient not in the PCRS file. If we just go back to PCRS Parser, if you haven't ticked that box on there, if I leave that open and I run the list and I have a number of doctors, you're going to get a lot of patients in that, because it's going to be looking at different doctors' listings in there, and you'll see a lot of records in there. So just be aware of that, just so you know that. So yeah, the patient not in the PCRS file means that it's on my Health One system with a valid GMS number, but it's not in the PCRS file. The next one down then, not matching doctor's name. So again, because I'm not in a kind of a valid doctor file or patient file in here, I'm not getting any results in there. But basically that would be, it will look at the PCRS file and look at the doctor in charge in there. It will look at Health One and it would say, have we got the same doctor and GMS doctor code against the record? And if we haven't, it will list it in here and it will show it to us. So we'll be able to update it from in there. So again, down at the bottom here, this option will be active and you'll be able to update the doctor, and that will update the doctor in Health One to whatever the doctor is on the PCRS list. This is the next one down is a new one, and it's coming. It might be in this release that's out there or the next release that's coming. You will see this on your list, and it's patient with a category change. And basically what that will mean is if on the PCRS listing, if the patient was say on your Health One system, the patient was a GMS patient and they had full GMS, but on the PCRS they've lost that, so they now have a GMS doctor visit card, and they come in to see you and you don't realize that the category has changed. So this listing is really useful in that it will show you here what the PCRS listing has. So if they're a GMS patient on the PCRS listing but you're showing as a DVC, you'll be able to update them in here. So that's a really useful list. And so again, you could go through them and you can update them one at a time with the update category down here, or you can just select them all and update them in one go. And like the other listing that we were looking at earlier on, we always want to go by, we want to always assume that the PCRS listing is correct, because they're the ones that are paying. So we want our list in Health One to be the same as what the PCRS have. So to be honest with this listing, you're probably just going to click and select all, clicking the little box again up in the corner and just pressing update, so that you have the same category on your Health One system as what the PCRS have. So that's patient with category changed, and you can see there I had 11 records. The next option down is IHI number updated. So again, I've no records in this, and that goes back to this listing. If I go back up to my PCRS parser, and if I had ticked on this auto update the IHI number, it would have shown me all my IHI numbers that I updated on this listing here. So because I didn't tick that on, I'm not seeing anything here. The last option then on the list is nursing home patients. And what this listing will show is basically it will look at the PCRS listing and it will see if anybody is a nursing home patient. So you may not know, you may not have updated your Health One system with that status. You might have them still in as a GMS patient when actually they're in a nursing home. So what this listing will do is it will give you that, it will show you that they're nursing home patients. And again, similar to the other lists, you could update them one at a time by highlighting and clicking update, or you can click on the little box in the corner here. So the grey box allows you to select all, and then you can do an update. So what that will do is, as I said, that will update the card type to GMS nursing home patient. It also updates the patient category within the system as well. So it's updating the category to whatever the category was on the PCRS listing. What you can also do in here is you can see the address of the nursing home. So you might want to see, you can group all your nursing home patients together in here. So if I click on the address, it will sort them in alphabetical order, and I can see all my kind of the same nursing home and all my patients who are in that nursing home together. So I then know that if I have patients in my Health One system that I have down as nursing home, I'm not being paid for them. I know that these are the only patients I'm being paid for as part of the nursing home. So again, it's a really handy listing. And all of them down at the bottom, as you can see, have a cube analysis beside them and have an export option, so you can export the list out and maybe do some work on it from there. You can also open the file from there as well. That's pretty much it on the PCRS parser. It is a really useful tool, as you can see. I mean, you really want your Health One system to reflect what the PCRS have to ensure that you're being paid correctly. So this PCRS parser will do that for you. So it's really useful to go in there and run this maybe, I don't know, once a week or once a month, and just make sure that the information that you have in Health One matches what the PCRS have. So that's everything. I'll take any questions if there's any.
Yeah, no, we haven't had any questions through as of yet. So if you do have one, just type it in the question box there and I'll ask it to Glenda. I had a couple myself, Glenda, if you don't mind. Just at the very, very beginning, the audio kind of cut out for me. So if you're coming into Health One cold and you want to get to this tab, do you just click the analysis tab up the top, or do you need to do anything else?
No, so you're going to go to Tools.
Okay.
So you're going to click on the Tools menu, and then down here you're going to go to GMS Duplicate Manager. So you're going to select this. This is the tool here. So when you click that, this is the screen that we land in. From over here on the side, we're going to go to PCRS Parser. So it'll be
Perfect.
this link here that we click.
Okay.
Yeah. And did it cut out when I was going into the PCRS website, or was that okay?
I think that was okay. But the only other question I have is, again, at the start you mentioned if you hit F1 while you're in the system, it'll bring up a guide on it. So you might just show that for the sake of doing
Yeah,
it, if you can.
absolutely. Yeah. If I just do an escape here, and I'll just go back out, and I'm pressing F1 on my keyboard.
Okay.
And when I press F1, it's like a help menu that pops up here. And you
Brilliant.
can see in here PCRS Parser 85 there. When I click that and I press OK and open it, I get a full breakdown of Word document step by step of everything I've just covered there today. So that document is in there available, and it goes through, particularly the beginning, to get into the PCRS, the listing in here. That will give you the step-by-step guide on how to get into it.
That's
so there's also kind of a breakdown and an explanation for all the different kind of, because sometimes looking at the links on the side, it can be a little bit confusing as to what it's actually analyzing. So this will kind of explain it in a step-by-step.
Yeah, handy to have it there written in front of you, I think, if you're going through it kind of bit by bit. But look, that was great.
Exactly.
We haven't had any questions, Glenda, so I think, look, we'll wrap it up there. If anyone does have any questions, please just drop us an email and we'll do our best to help you out. And
absolutely.
As always, I'm going to upload this video to YouTube probably this afternoon, and you can find it there. If you search for Health 1 Lunch and Learn, you should get a list of all of the webinars that we've done to date. As always, thanks a million to Glenda. I think that was a really comprehensive overview and should help everybody sort of with the whole process of everything and making sure that it's all reconciliated. And thanks a million for joining us. And
thanks,
we'll
guys.
see you again soon. Cheers. Bye bye.
Thanks. Bye-bye.